Based on her presentation, the patient falls under the category neck pain with coordination impairments and is currently in the subacute phase of rehabilitation. The accident resembles a whiplash injury where her head flew backwards after she got hit and pushed forward by someone. She is experiencing frequent headaches, inconstant pain, aggravated during and range neck movements, and has difficulty sleeping due to pain. She also is positive for the deep neck endurance test as well. Patients in this category shows lack of strength and endurance of neck muscles, where pain is present from neck movement mid-range and it gets worse at end range. Patients may also show trigger points, impaired muscle activation patterns, proprioceptive deficit, and postural imbalance impairments. In addition, patients test positive for cranial cervical flexion and neck flexor muscle endurance tests. During the subacute phase, one of the most important interventions is to educate your patient how to activate their neck muscles. Combined exercise of active cervical range of motion and low-load isometric strengthening is advisable. Stretching, endurance, postural coordination, and deep neck flexor stabilization are also important interventions for people who are in the subacute phase. Neck Disability Index is a score on how you determine the patient's neck pain, how it's affecting their activities of daily living. In this case, the patient scored 46%, meaning she is having difficulty doing some functional activities due to pain and limitations. For instance, the patient is having difficulty washing her hair, driving because she has to turn her head sideways. Scores may also be affected by having headaches, difficulty in sleeping, having a hard time concentrating in school, and also the inability to do kickboxing. Deep neck flexor test is used to assess the patient's deep cervical muscle endurance, to classify neck pain with movement coordination impairment, and is important to establish a baseline of treatment. For this patient, she tested positive with 12 seconds, which implies decreased endurance in her deep neck flexors because the average normal range for women is 29 seconds. This contributes to the patient's neck pain, headache, and may result to neck instability and postural impairment. It is advisable to provide education which will include limit of cervical collar use, emphasize postural and mobility exercises to decrease pain and increase range of motion. Focus on patient's independence through involving with home exercises program and to reassure recovery times, which in this category and phase averaging to 2 to 3 months. For this patient, it is best to start off with active cervical range of motion on all planes, followed by cervical thoracic muscle stretching, isometrics focusing on lateral flexors / rotators, and deep neck flexor stabilization exercises. Patient is in the subacute phase and will benefit from early mobilization, strengthening endurance, and flexibility training to be able to reduce neck pain, increase range of motion, regain functional activities, and to avoid risk of progression towards chronicity of the condition. So now I am going to demonstrate 2 exercises that I would ask the patient to do for her treatment session today. We can start off with the first one, which is stretching her upper chaps. I would ask the patient to bring her left ear to her left shoulder and then grabbing with her left hand, pulling on the same direction, holding it for 30 seconds, 3 sets each on both sides. So it will look like this. Okay, and then other side. Again, 3 sets, 30 seconds each. So now for the second exercise, we are going to do the deep neck flexor stabilization exercise. So we are going to ask the patient to lay on the bed, tuck their chin, and then lift their head off the bed a little bit, just a small one, like half centimeter. And then they should hold that for 10 seconds, 10 reps, 2 sets. All right. So I'm going to show you this right now. Lay on the bed, tuck your chin, And then when you lift your head a little bit, your chin is still needs to be tucked. Let's pretend that's 10 seconds, but that's how you're gonna do the deep neck flexor stabilization exercise.